examination of the motor system. So while assessing the motor system, we'll observe the patient's position, any involuntary movements, also the characteristics of the muscle tone, the muscle strength and the coordination. So for the body position, we will be observing the patient's body position at rest, and while movement, move your hands. Okay, relax. So for the involuntary movements, we will observe if the patient has any tremors, any chorea or fasciculations, and also we will note the intensity if any of such is present. So can you show me your hands? So there are no tremors present. Also there are no fasciculations. So for the muscle bulk, we have to notice for the contours of the muscles. So we have to also inspect if there is any atrophy, none is seen here. You have to see the bulk of the shoulders, the arms and the thighs. There is no atrophy seen. Also we have to inspect for the dorsal interossei. It should be either full or slightly empty, but here it is full, there is no atrophy seen. Also the hypothenar and the thenar eminences are prominent, there is no atrophy seen. So for the muscle tone, so when there is a muscle with an intact nerve supply which is relaxed voluntarily, it maintains a certain residual tension. So here we will be testing for the muscle tone. So for that, raise your, okay, slightly flex. So now you have to extend and then again flex. Also your fingers. Okay. Okay. So there is a slight residual tension maintained even in the relaxed position. So that is muscle tone. So now we will be testing for the muscle strength. So while testing for the muscle strength, usually we'll ask the patient to resist our movement. Also while assessing, you may see that the dominant side of the patient is usually stronger than the non-dominant side. Also if a muscle is short, it is the strongest, while a long muscle will appear weak. So now we will be testing for the flexion that tests the function of the biceps and the brachioradialis, also the C5 and the C6. So for that, flex your, so you have to try to pull your arm this way, okay? You have to try to flex it against my resistance. Okay, now try to pull. Okay. Okay, that's it. So now we will be testing for extension that helps us to assess the function of the triceps, also the C6, C7 and C8. For that, now you have to try to push your hand backwards, okay? Try to extend your hand. Okay, now try. Okay, now again. Okay. Okay, so now we are testing for extension at the wrist. So you have to make a fist like this. Now I'll press your fist downwards. You have to resist my force, okay? Okay. Okay. That's normal. Now we will be testing for the grip, that is a function of the C7, C8 and T1. So you have to hold my make a grip and hold it as tight as you can and then let it go. Okay? Okay. Now hold it as tight as you can. Now let it go. Now hold both sides. Okay. Now you So now we will be testing for abduction, that is a function of the C8, T1 and the ulnar nerve. So for that, you have to move your fingers like this, abduct them. Okay. So now I'll be applying pressure over here and I'll try to move them towards, and you have to maintain your position. You have to resist my force. Okay. Okay, now we'll be testing for opposition, that is a function of C8, T1 and the median nerve. So for that, you have to try to touch the tip of your thumb to your little finger and I will resist you. Okay? Okay. Now try to touch your little finger. Okay, you may relax. So now we are testing for flexion at the hip, which is a function of the iliopsoas, the L2 and the L3 and the L4. So here we will be placing the hand on the patient's anterior thigh and you have to raise your leg. Raise your leg. Okay. Again. Once more. Okay, you may relax. Testing for adduction at the hips, that is a function of the adductors, the L2, L3 and the L4. We'll place our hands firmly in the bed between the patient's knee. Now you have to try and bring both of your legs together against my resistance. Again. Okay, you may relax. So now we will be testing for abduction at the hips, that is a function of the gluteus medius and the minimus, also the L4, L5 and S1. Now I'll place both my hands firmly on the outside of the knees and you have to try and spread both of your legs against my resistance. Okay? Okay. Begin. Okay. Again. Okay, that's good. You may relax. Testing for the extension at the hips, that is a function of the S1 and the gluteus maximus. So for this, I will ask the patient to push the medial posterior thigh downwards. Try to push it. Again. Again. You may. So now we will be testing for the extension at the knee, that is a function of the quadriceps, also the L2, L3 and L4. So for that, I will be slightly flex your knee. Okay. Support the knee in the flexion and ask the patient to straighten the leg against my resistance. Okay? You have to try to straighten your leg against my resistance. Now try to straighten it. Again. Once more. So now we'll be testing flexion at the knee, which is a function of the hamstrings. So we'll put the knee in a slightly flexed position with the heel of the foot touching the bed. Now I will try to straighten your leg, but you have to try and maintain the heel of your foot on the bed. Okay? Okay. Now we will be testing for the foot dorsiflexion, which is a function of the tibialis anterior and the L4 and L5, and the plantar flexion, that is a function of the gastrocnemius and the soleus, also the S1. So now try and push my hand. Again. Again. Okay. Now try to pull your leg. Again. Again. Okay.